I'm Jonathan Lammers. I'll be a physician at Mid-Lakes Medical Care. I went into medicine for several reasons. Medicine was always so interesting and there's so much to it, from the scientific part to the human part. And family practice in particular, I thought, exemplified that even more, where there was so much to it. It was something different every day, from cradle to grave, and everything in between just was really appealing to me. The Finger Lakes, there's so much to do, and it's so close. We can drive 10 minutes and be kayaking on the lake. We can drive 10 minutes another direction and be at a mall. I reached out to UR Medicine and Thompson Health in specific. Started from just looking online at what they stood for, and their website talked about how Thompson Health is listed as one of the top 150 employers for healthcare in the United States. I moved to a small community. Honestly, I've mostly always lived in small communities, so a lot of it is familiarity. It has that smaller feel where you can know everybody there who you work with, you know who your specialists are, you know who your co-workers are. Really makes it easy to be confident that that you trust them because you know who they are. My favorite part of practicing medicine depends on the day. And some days it's the interaction I have with children who are there. Some days it's more the scientific part of it, finding out what is working for somebody, or not working, and trying to come up with a better solution. Some days it's a procedure, where you can do a joint injection and they feel better when they leave the office, and that's very satisfying. I also enjoy diabetes. It's kind of near and dear to my heart. I have taken care of a lot of diabetics in their families. I'd like patients to know that I have a collaborative approach to care. For example, patients often come in after looking at Google. They look up their symptoms and they have a specific concern. I'd like to know that. That way I can address it. So I ask them, did you look this up, or what is it specifically that you were wanting to know about? And 9 times out of 10, I looked it up on Google and it said I could have cancer. So I said, then I can explain to them why I don't think they'd have it.